Okay, this lecture is going to cover health promotion for adolescence, which is a period of time not too far in the past for most of you. It is definitely not as robust or lengthy as some of the other age groups, but there's some important concepts here that you're going to want to be aware of. So adolescence is a time of great change and development for children. They are transitioning from childhood to adulthood, and this includes some very pivotal phases and choices that are made during adolescence can have lasting health implications. So adolescence can be considered in 3 different phases: early adolescence from about 11 to 14 years, middle adolescence from 15 to 17, and then late adolescence from 18 to 22 years. So this still includes most of you, right? In adolescence, children gain the final 20 to 25% of height and then up to 50% of their ideal adult body weight. So that is a lot of growing. It's not as fast as infancy, but it's still a time of tremendous growth and change. And this may be why some adolescents will become clumsy and awkward, especially during growth spurts. The pubescent growth spurt occurs earlier in females, generally between about 9.5 and 14, with an average of 12, and then between 10.5 and 16 with an average of 14 in males. As their bodies continue to grow and reach adult height and weight, vital signs will obviously then start to become more even with. All right, a quick overview of puberty. I know this has been covered in other classes, so we're just going to do a very brief review and then talk a bit about sexuality and sex education. Estrogens and androgens increase in their respective biological sexes during puberty, which then leads to secondary sex characteristics. And so these are physical changes in sexual maturity, which is measured using a system called the Tanner stages. So the images here are a reference to those different stages, and you could see these stages documented in a head-to-toe assessment. Failure to develop as expected would lead you to draw some labs and maybe do some investigative work to figure out why. Alternatively, if you see secondary sex characteristics earlier than expected, such as breast buds in a 6-year-old, we may consider them precocious or early puberty, and that's something that we will talk a bit more about in endocrine. Sex education should be accurate and include both abstinence and safe sexual behaviors. Prevention of STIs, pregnancy, and discussion of mutual consent should be included and reinforced. It is important to recognize that sexuality can come with shame, bullying, parental non-acceptance. So education needs to be provided regardless of sexual orientation or choice of partner in a non-judgmental way that provides the teen with the information that they need to be safe. Your psychosocial development during adolescence can be summed up in basically one word: autonomy. Okay, it is called identity versus role confusion, but it's really talking about them developing their own self-identity and becoming autonomous. Adolescents strive to become independent from their families and develop their own personal identity. So this often involves a close group of peers to help them navigate this time. And you probably, again, remember this period of your lives. Friend groups become exceedingly important. And then through this, the adolescent continues to develop and deepen their self-concept and their body image. Even though this time period is often seen as a time when adolescents are in a group and identified by their group, it also sort of conversely is this time of great self-awareness. As far as cognitive development, adolescents are in formal operations, which is the 4th stage of cognitive development, and this is the time of possibilities. They are very forward-thinking, thinking about where their life might go, like college or trade schools or work. They're able to use scientific reasoning and logic. They're able to consider complex decisions with multiple changing variables, which makes them able to have more complex planning and thought, right? When making decisions, they're able to understand that there is nuance. It's not just black or white, right or left, one way or another. There's oftentimes many other things that they have to take into consideration. This complex thought also makes them able to really be aware and concerned of others' cultures for the first time, to understand other cultural norms and take this into consideration outside of their own experiences. So in terms of promoting optimum health during adolescence, we're looking at nutrition, their dietary needs. We want to be concerned about eating disorders at this time, and then obesity, talking to them about physical fitness. Hypertension and hyperlipidemia start to become a little bit more prevalent in this age group. And then we obviously will always have immunizations, sleep. Nutrition is another area to consider when working with teens. There's several factors that influence a teen's nutritional status. For example, puberty requires increased intake of protein and iron and zinc. Focus on their physical appearance may mean that teens are constantly dieting to achieve that perfect figure. Their need for peer acceptance can alter their nutritional intake, like, what does the group always eat when they go out to eat together? And then finally, their growing independence will affect their choices as well. 20% of teens struggle with obesity. 70 to 78% of that 20% will remain as obese adults. Eating disorders are also a growing problem in this age group. The rate of children under 12 being admitted to a hospital for eating disorders rose 119% in less than a decade. So that's a pretty significant increase, and this includes eating disorders such as anorexia, bulimia, ARFID, and binge eating disorders. So parents should continue to model healthy eating behaviors. They should avoid using food as a reward and emphasize physical activity. Around 11 to 12 is sort of where we start to talk about teen immunizations, okay? And so that's when the CDC would recommend the Tdap, the meningococcal, the HPV vaccine. We've talked about those already last week, right? The Tdap has been available and is recommended now due to outbreaks of pertussis that are still continuing in the adolescent population. I think there's actually current outbreaks right now in some schools. I feel like I heard there was like something in like Tuscola or Arcola, somewhere south of here a little bit, where they had a big pertussis outbreak in the middle school or the high school. The meningococcal vaccine can start at 11 to 12 and then again with that booster at 16, so that those 18 to 21-year-olds that are living in group settings are being covered. And then, as I said before, the HPV vaccine should be administered with the goal of being given before the child is sexually active. And then the Hep A series should be offered, as it's now given to infants at 12 months. And so not everybody has gotten that. And so it's important to look back at immunization records and just make sure that that had been covered. And then as well as your yearly influenza and COVID. Teens and sleep. We all know they sleep a lot, right? And that is because they are at this very important stage of growth and development where they are growing rapidly. And so they need more sleep than adults. The average teen needs about 9 hours of sleep a night in order to feel alert and well rested. And frustratingly for their parents, they often stay up late and sleep in later, which is not conducive to early mornings for school. There are many factors that keep teens from getting enough sleep, and so education should be ongoing with them on the importance of adequate rest for their growth and development. So the leading causes of death in children 15 to 19 years of age include accidents or unintentional injuries. That's things like motor vehicle accidents, drowning, accidental firearm discharge, and then suicide and homicide. Suicide rates are 3 times as common in males, and you can see a pretty significant increase in both suicide and homicide starting in 2019. Now this chart does show the ages of 10 to 24, so it does cover a pretty wide range there, but you can see how suicide has pretty steadily risen. Homicides had a little bit of a dip and then have been cruising upwards since about 2014. Unfortunately, there is no data for 2021 to 2024, so this is what we have to look at right now. Adults have sort of long used a don't ask, don't tell approach with teens, thinking that if they broach the subject of self-harm or suicide, that they would put that idea into the teen's head. This is not true. We need to be asking about self-harm. We need to be screening for mental health and supporting kids, because this is becoming a growing issue in this age group. One way that we have historically checked in on this has been through the Youth Risk Behavior Survey. The YRBSS was developed in 1990 to monitor priority health risk behaviors that contribute markedly to the leading causes of death, disability, and social problems among youth and adults in the U.S. Now, these behaviors, often established during childhood and early adolescence, include behaviors that contribute to unintentional injuries and violence, sexual behaviors related to unintended pregnancies and STIs, including HIV infection, alcohol and other drug use, tobacco use, unhealthy dietary behaviors, and inadequate physical activity. In addition, the YRBSS monitors the prevalence of obesity and asthma and other priority health-related behaviors, plus sexual identity and sex of sexual contacts. So from 1991 through 2015, the Youth Risk Behavior Survey has collected data for more than 3.8 million high school students in more than 1,700 separate surveys. So a whole lot of data, right? So what is the purpose of this? Well, it was designed to determine the prevalence of the health behaviors, to assess whether they are increasing or decreasing or staying the same over time, to examine the co-occurrence of health behaviors. Does someone smoke and drink, and does that make them more likely to do those two things together? Provide comparable data among different regions and subpopulations of youth. So for example, in the app on the CDC website, you could put in, different counties, or California to New York, or break it down by ethnicity, sexual orientation, geographical location, which I kind of already mentioned, and compare across. And then, it's used to monitor progress towards achieving the Healthy People objectives and other program indicators. So these surveys are conducted every 2 years. In fact, you might remember having done it. It's usually during the spring semester by the CDC, and there is one due, I believe, this spring. I think the last one was in 2023. Another issue to consider is that of confidentiality. It's known that adolescents will not seek health care if they do not believe that the healthcare provider will maintain confidentiality or that they'll tell their parents. They may also withhold information that could jeopardize their treatment. So what is a healthcare provider to do? Well, the Society for Adolescent Medicine has stated that parents and teens need to know from the beginning that confidential information will not be shared with the parent or others unless the teen is placing his or herself in an unsafe situation. The question then remains as to who will pay for the care if their health isn't disclosed, right? Most states will allow healthcare providers to provide treatment to those 18 years of age for drug, alcohol, or less than 18 years of age for drug and alcohol abuse, STDs, and mental health issues, but states do have variable laws on things like contraception and reproductive issues, and those may be changing. So to know what a specific state allows, you have to look it up. Teens may also be declared emancipated minors, meaning that they are independent of their parents, and this can happen through marriage or military service, and the courts will, or any other, not any other, but some other reasons, and the courts would recognize them as responsible for their own healthcare decisions. So a situation that you may encounter in the hospital is a teen parent. In this case, they can make medical decisions for themselves and their child, but they cannot make legal decisions for themselves, such as finances and assets. So it's kind of an interesting situation, can be a little bit confusing. Now, there are a few approaches to the psychosocial interview of a teen, and this isn't in your ETI, so I don't love covering it too much. The main takeaway here is that the HEADS assessment is the most practical, time-tested strategy. It utilizes open-ended questions, starting with less personal topics to develop rapport, and then moving toward more personal or difficult conversations. This is similar to the least invasive to most invasive approach with children. We'll tackle the easy stuff first, and then move into the topics that may be uncomfortable. Okay, and that concludes our lecture on adolescence. Have a great day.